In Health and Wealth, tips on how to avoid letting a food issue ruin your holiday season. Here to help with that is Dr. Wajahat Mehal, Professor of Medicine and Digestive Diseases at Yale University School of Medicine. Thanks for coming on our show, Doctor. Do most people know they have food sensitivity issues, or is this something that often goes undiagnosed?
No, that's an excellent point. And unfortunately, the vast majority of people are not aware that some of their symptoms may be because of food sensitivities. So I think that's one of the issues that we're hoping to raise awareness of this topic.
What can you tell us about the recent study conducted at Yale University, and what does it reveal?
So because it's so difficult for patients to often, self-identify if they have a food sensitivity and which food it might be that they're sensitive to, there are a number of blood tests that can help guide patients. And we actually used one of the better known ones, the ALCAT test. And then what we did was we performed a clinical trial. It was blinded and randomized to see if the guidance from the ALCAT test can actually help our patients. And what we found was that our patients with irritable bowel syndrome, that when they used the guidance from the ALCAT test, actually their symptoms improved significantly.
Tell us more about how this actually works.
Sure, of course. So on the practical side, either through the healthcare provider or directly, patients can order the test and they'll send off a blood sample. And then the blood sample is actually tested against over 400 food items to see if there's any reactivity. And then the patients or the healthcare provider get a very clear set of information, which usually identifies about half a dozen or so foods that the patient is sensitive to. And then, there's also access to a dietitian who can help the patient advise them on how they can modify their diet to avoid those foods that they're sensitive to.
What's the best way for people to get information?
Yes, they can go to Previmedica, Previmedica.
Before you take off, I'd love to know, what are some of the symptoms of food sensitivities and what happens if patients avoid getting checked out?
So many of the symptoms are GI or stomach related, such as abdominal pain and bloating. But some patients actually have symptoms outside of their abdominal area, such as arthritis or just malaise and fatigue and sometimes headaches. So the symptoms can be very broad. And the consequences of these, because they're long-term symptoms, it can be a domino effect. So, for example, if someone is feeling fatigued, it's unlikely that they will exercise and keep up with their general health. So it can really have a domino or snowballing effect onto other aspects of their health.
Thank you, Doctor, for all of your information today.
Thank you. Nice to meet you. Take care.
Go to businessfirstam.com for where to see our show on TV.